Hello, everybody. Thank you for being here today. We're going to start in just a moment. We'll let people trickle in. I'm going to share my screen and talk about a couple upcoming events that we have. All right. Thank you for being here today. Just a couple upcoming webinars that we have at COEH. Next Wednesday on May 20th, Missy Smith from the Deep South Education and Research Center will present on the intersection between artificial intelligence and wearables in safety-related context, talking about a human-centered approach to wearables and exploring what that looks like. Again, that's next Wednesday. Then with the California Labor Lab on May 27th, Alexandra Ravenel will present her work on depictions of gig work in film, especially in the 2025 film Good Fortune. And that's going to be on Wednesday, May 27th. Lastly, in early June, Wednesday, June 3rd, Hestia Rojas and Linda Lee will have a webinar regarding the do's and don'ts of employing teen workers in California, especially for small businesses to ensure workplace safety for this sector of workers. And this is presented in partnership with the Labor Occupational Health Program, COEH's sister organization. For more and to register for all of these webinars, you can visit coh.berkeley.edu/webinars. I'll drop a link in the chat. All right, so for today's webinar, thank you for being here today and showing your support. I'm excited to introduce our speaker for today's webinar on the role of motivation in occupational health and safety. Just a few housekeeping items first. You're going to be muted during this presentation. If you would like to ask a question, please use the Q&A box at the bottom of your Zoom screen. We're going to save time at the end of the presentation to address as many questions as possible. And we'll also have the chat open, so feel free to use it and participate to join the conversation. This presentation is being recorded and will be made available on our website within 5 business days. And all participants who logged in with the registration email for the full live presentation today will receive a link to an evaluation form, which will also qualify participants for a certificate of completion worth 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. Now, I'm pleased to present our speaker, Hannah Frame. Hannah is an industrial hygiene PhD candidate in the Department of Environmental and Public Health Sciences at the University of Cincinnati. Her research focuses on occupational health and safety motivation, the impact of health and safety training on worker safety behavior, and compliance with safety policies and procedures, and the use of extended reality and eye tracking technologies to assess aviation worker health and safety outcomes. Her work probes the connection between focus during training and self-reported occupational health and safety motivation, and explores which environmental and training aspects can be modified to improve worker retention of safety knowledge and reduce injuries in critical care settings. It's great to have you today, Hannah. I'm going to stop sharing my screen and I'll pass it over to you.
Perfect. Thank you so much. And thanks everyone for being here. I will go ahead and share my screen and get in presenter mode. Are you seeing the presentation, Will?
Yes, that looks good to me. Thank you.
Perfect. All right, I will go ahead and get started. So thanks everyone again for being here. Today my presentation is titled Examining the Role of Motivation in Occupational Health and Safety, Insights for Research and Practice. Since occupational health and safety motivation is a more emerging pillar of industrial hygiene as well as occupational health and safety, today's presentation will be a little bit more broad. So our learning objectives are, at the end of this, you should be able to describe what occupational health and safety, or OHS, motivation is. effectively distinguish between the five different types of occupational health and safety motivation. I will describe all five types and then we'll have an opportunity to kind of quiz ourselves and figure out which type of occupational health and safety motivation you would function under. At the end, you'll also be able to demonstrate an understanding of the importance of occupational health and safety motivation and how it impacts worker health and safety outcomes. And then start to think about ideas for implementing the concept of occupational health and safety motivation into research as well as practice. So before we get in the content for today, I invite each of you to consider the last time that you knowingly took a small risk. And this could be from running through an intersection on a yellow light because you think you're going to make it, carrying too many things into the house at once instead of taking two or more trips. It could be standing on a chair instead of getting a ladder or a step stool, or even standing on the countertop to reach a tall counter or to reach a tall cabinet, sorry, or doing something that I am very guilty of doing a lot, which is picking up my phone while I'm walking through a crowded area or going down the stairs. So I invite everyone to take about 30 seconds, think about that risk, and then ask yourself why you took it. All right, so hopefully everyone has had the opportunity to think about the last time that you knowingly took a small risk or did something that we know is against safety or our better judgment, and you've been able to think about why. So some of the most common reasons why we might take these risks is time pressure, right? So I need to be somewhere. I'm running late, so can't afford to sit through this red light. Or maybe I need to go put these groceries down so I can head out for my next task or errand. Confidence is another one, right? I am confident that I'm not going to fall off this chair because I've done this task before and I've never had an injury or I've never fallen off. It also could be habit is a big reason. So we habitually kind of reach for our pocket and pull out that phone when we're walking through a crowded area or walking down the stairs. So things like time pressure, confidence, habit are all reasons that we take risks in our daily lives. And these are all pretty small risks, right? So generally nothing bad happens to us. So we aren't super risk averse when it comes to these daily tasks. Workers are faced with these same small decisions every single day. Do they take the extra time to fill out the checklist fully and follow the policies and procedures? Or since nothing bad has tended to happen, they are able to cut that corner. So again, let's scale our example a little bit. So my work is focused heavily in the aviation industry. I look at a lot of aviation workers. Specifically, I look at maintainers, cargo loaders, those in healthcare and aviation, wing walkers. I specifically focus on non-pilot populations due to the injuries that those folks face. However, since pilots are pretty accessible and well known to the general population, we're going to use pilots as our example. So let's think about we have two pilots and they are flying the exact same aircraft. They're on the exact same route. They have the exact same training and the exact same procedures to follow. They have the same crew working with them, the same weather. Essentially, everything about these two pilots is exactly identical, except one of the pilots follows the policies and the procedures exactly, but the other does not. I invite you again to take about 15 seconds and think about why one person might follow those policies and procedures while the other one does not. So likely you came up with similar reasons to why we take risks in our daily lives. It could be habit, convenience, or even time pressure. In aviation specifically, time pressure is a really relevant construct. So in commercial aviation, nobody wants to sit on a runway or have their flight delayed or canceled. So they focus on uptime and turnaround of the aircraft. Similarly, in military settings, they have something called operations tempo or ops tempo, which focuses on getting work done in a very fast pace and getting it done quickly so that way we can complete missions in a timely manner. Confidence is another big one for workers as well. So they're very confident that something has never happened. With hearing loss, especially in aviation populations, you see workers who say, well, I've never worn hearing protection and I don't have any hearing loss. So why would I start today? I've been doing this for my whole career. But when we look at these two examples, which aircraft do you want to be on? And I think the answer for all of us is probably that we would want to be on the aircraft with the pilot who is following all of the policies and procedures exactly correctly. And the difference in the performance of these two situations is not due to the technological capabilities of the aircraft or even the content of the training that the crew has received or that the pilot has received. It actually comes down to the motivation and the human factors of the pilot who is behind the controls of that aircraft. And a lot of work in industrial hygiene up to this point has focused on aspects of the hierarchy of controls like engineering controls, substitution, elimination, even administrative controls. And while these things are critically important, it's clear that at this time we need to focus on the individual human components of the workplace to mitigate injury and risk moving forward. So, looking at motivation in the workplace specifically, occupational health and safety has success being defined as the absence of an accident. And this is really unique to industrial hygiene and occupational health and safety in general, right? So think about sales. If I'm a salesperson, success for me is going to be completing that sale, and I can see that check in my hand. It's tangible. Even in kind of a similar kind of neighboring field, medicine. So, right, a surgeon can see success because they have their patient wake up and their patient heals from the surgery. Many workers and careers are able to see the outcome of their work being done correctly. But in safety, if we follow our procedures, typically nothing happens. If we have a new policy or procedure that we implement, and we don't see the same accident or incident happen over the next 6 months, do we know, was it the control? Were we just lucky? Did the hazard not come up, or was the risk not as serious as we thought? It's really hard for us to tell what is actually working when we're looking at the absence of incidents. Industrial hygiene has really invisible success, and that's kind of the crux of where we're at this point, where doing everything right can have similar outcomes to doing things wrong in a lot of ways, right? So when workers don't see the fruits of their efforts or the fruits of their labor come out, the perceived value of that effort can decline over time. Motivation specifically really thrives on positive feedback loops. So it's been demonstrated that when people are incrementally praised or told that they're doing a good job or that their work is correct or even great, they are more motivated to continue to work in that same manner. So then we start to wonder, in the absence of positive feedback, kind of what is happening, what is motivating the worker, and what is allowing them to behave safely, not only following policies and procedures, but also recognizing hazards, anticipating them, and at times going beyond what their formal training has indicated. So this brings us to occupational health and safety motivation. So occupational health and safety motivation takes on a more granular perspective of the overarching idea of motivation, and it describes the factors that compel workers to behave safely. These factors could be internal or external. So they could come from the worker's own values and attitudes, beliefs, ideas, or could be components of the external environment that compel the worker to behave safely. So I'm going to invite everybody to think about what makes you behave safely in the workplace. I'm going to invite you to either remember this or just jot it down on your notes or something like that. So that way, when we go and talk about the types of motivation, you can bring it up and we can kind of figure out what type of motivation you might function under. So again, take about 30 seconds right now and just quickly jot down what factors would compel you to work safely. All right, perfect. Hopefully, everyone has had the opportunity to brainstorm and write down some of the factors that would compel you to behave safely in the workplace. And so now we're going to talk about the different types of occupational health and safety motivation, and then we'll kind of try to figure out what type of motivation you might be functioning under. So the first one is amotivation. Under amotivation, workers are not motivated to behave safely, so a lot of times they just don't, right? And this could be because they themselves don't see the value of safety or their environment is not conducive to safe behavior. They don't believe that safety makes a difference. Regardless, whatever it is, whether it's the worker themselves, their environment, the culture that they're in, they just aren't motivated to behave safely and therefore they do not. The next type of motivation is external motivation. So, someone who functions under primarily external motivation does so because of the positive or the negative consequences of safe behavior. So, this could be I want to be recognized by my supervisor, or I don't want to receive a corrective action like a write up or a suspension. It could also be I want to be eligible for the end of year party or the end of year bonus we get if we have a certain number of accident free work days. Um, or I don't want to be fined if you're looking at a more organizational level. External motivation is also kind of further granulated into material and social outcomes. So, material outcomes that could be motivating would be like, I want to be eligible for that bonus, or I don't want to get the corrective action. Whereas the socially externally motivated components would be, I want to make my supervisor proud of me, or I want to get that praise from my supervisor, or I don't want to be viewed negatively by my supervisor, as examples. Next up is introjected motivation. So those that function under primarily introjected motivation do so because they have some level of guilt or shame or self-worth that's dependent on safety and safe behavior. Someone who has introjected motivation might say that they feel bad or they feel guilty or ashamed if they don't behave safely, kind of like they're letting down somebody else if they don't behave safely. The next kind is identified. So this describes somebody who understands the importance and the value of behaving safely. So someone with identified motivation might say that I think it's important to behave safely, or I think it's important to comply with the rules and the policies and the procedures that our workplace follows. So therefore, I behave safely. With this as well, it could be really critical that the workplace could modify the rules that compel workers to behave safely, right? So if I don't necessarily see the importance of safety, but I see the importance of rule following, my workplace can kind of push me to behave safely by making it so the rules dictate that I must behave safely. Overall, external, introjected, and identified really rely on external feedback and external influences to influence behavior. So this is really where that positive feedback can help influence our workers. So if we have workers that are primarily in these categories in terms of safety, that external feedback does a great job in compelling them to behave safely and exhibit safe behaviors throughout the workplace. But overall, we also know that those who function under intrinsic motivation tend to have the most goal-oriented behaviors and have the best outcomes when it comes to health and safety performance in the workplace. Those with intrinsic occupational health and safety motivation have some kind of interest and enjoyment in safe behaviors. As you'll see at the bottom of this as well, that arrow that says increasing self-determination goes from the left to the right. And I will touch on self-determination theory and what that says about motivation and workplace context and things like that a little bit later in today's presentation. But as you move to the right of these five categories, it becomes more and more on the worker and the worker's internal beliefs and attitudes and behaviors to dictate their response to the environment, right? So there's only so much you as the employer or you as the workplace can do to kind of push employees toward that safe behavior and that safe outcome, where it becomes more on them at some point to do what they know is right or what they know will keep them safe in the workplace. So now that we've kind of gone over the five categories, I want you to kind of refresh yourself on that reason that you wrote down for behaving safely in the workplace. And I'm going to go through kind of a screening questionnaire and tell you which ones you align with best based on your response. Typically, people fall pretty cleanly into one of these five. But again, it is context dependent. And in one place, you could be really intrinsically motivated, and in another place, you could function more under external motivation. So if I ask you the question, why do you put effort into working safely? And your answer is that you have fun while working safely, it makes you happy, or you enjoy it, or your answer kind of aligns with one of these bullet points, then you function mostly under intrinsic occupational health and safety motivation. If your answer to that question is because putting effort into working safely is important to you, or you believe it's important to put effort into working safely, or that working safely just aligns with your value system and your personal values, then you are functioning under the identified type of motivation. If your response aligned with the idea that you would feel bad or guilty or ashamed if you didn't work safely, then you function more under the introjected type of occupational health and safety motivation. If your kind of primary drivers to work safety are to avoid criticism or to get approval, or because other people are pressuring you to work safely, then you are more in the external occupational health and safety boat. And then if you don't put effort into working safely because you don't believe it makes a difference, or it's not a priority for your workplace or for you, or you just don't think it's worth the effort, you're not seeing the return on that effort, and you're not seeing the changes being made in real time, then you would be considered amotivated. And these questions come from a questionnaire. It's called the Self-Determined Safety Motivation Scale, that can be used to assess what type of motivation workers are functioning under. And I use this a lot in my research. And a bit later, I'll show you kind of some of the preliminary results that I'm seeing in the populations that I'm studying. So we're back to our occupational health and safety motivation types, these 5 types with increasing self-determination. So these 3, external safety motivation, introjected safety motivation, and identified safety motivation, function pretty heavily under the extrinsic safety motivation category, right? So these are the 3 types of motivation that the external environment can really control, right? So I can put in really harsh corrective action for severe safety violations. I can put in incentives, kind of, monetary or social incentives in some way. I can train supervisors to verbally engage with their employees in a specific manner to kind of cultivate the response that I want. I can modify the rules and the regulations and the policies and the procedures of my workplace to make it so workers who value rule following will value and follow the rules of safety. Controlled safety motivation really narrows in on external and introjected. Controlled safety motivation, this idea also implies that someone follows these procedures when they think they're being watched or when they are being watched by their colleagues or their supervisor or management. But it also implies that somebody would cut corners when they're not being watched or they don't think that they're being watched, right? So if your only motivator is to avoid getting in trouble or to be eligible for a bonus and the person who dictates that isn't in the room with you, then, you're probably not going to have that motivation to comply. And then finally, autonomous safety motivation describes identified and intrinsic safety motivation. So these are the ones that it's on the worker to really drive that sense of occupational health and safety motivation, and the worker has to compel themselves to behave safely. A key point about this figure, you'll notice that identified sits between extrinsic safety motivation and autonomous safety motivation. And this kind of comes down to what the identified reason is coming from. So if you go to the worker and their reason for behaving safely is because they see the importance of safety itself and they see the importance and the value of behaving safely, then they really sit in that autonomous category, right? Because that value and that belief has come autonomously from the worker. However, if they see the value and importance of following the rules and complying with workplace policies and procedures, and their motivation to behave safely is because the rules or our standard operating procedures outline that I must behave safely, then they fall under the extrinsic safety motivation category, right? Because if your value is in following the rules, then I can modify the rules to dictate safe behavior in that way. And this kind of idea of occupational health and safety motivation is based on self-determination theory. And self-determination theory talks about the beliefs, skills, and knowledge that is necessary to behave in a goal-oriented way. And a really accessible example of self-determination theory is a lot of times in like health behavior. So if I, for example, want to start eating healthy and exercising, I have to have the belief that I can do that and that I actually can make those different choices. I have to have the belief that those choices will actually make a difference in my life and that I will actually feel better as a result. I have to have the skills to do so. So I have to know, what exercise can I do that will help me? What food can I purchase and where can I get that? And then that kind of goes hand in hand with knowledge as well. So you have to have the knowledge and the resources to behave in that goal-oriented manner. Self-determination theory also posits that humans have three basic needs, and those basic needs are autonomy, competency, and relatedness. So when it comes to autonomy, essentially we have to be able to choose and feel like our choices are not being fully dictated on our behalf. We have to have a feeling of efficacy through competency and feeling like we actually can make a difference and we do have the power to kind of steer the direction of our work and our life. And then relatedness. We have to have some sense of connectedness and belonging with others. So if we take this back to that example of, choosing to eat healthier foods and choosing to exercise more, I have to be able to choose that change for myself. I have to feel like I have to feel efficacy and feel like I actually can make a difference. And then I have to feel connected to others that have made similar changes or those that are demonstrating that outcome that I'm looking for. And this holds true in the workplace as well. So workers, when they have the ability to choose, they feel like they are actually able to affect the outcome of their job or the outcome of their work. And when they feel connected and like they belong to others in the workplace, that is when you see the best outcomes based on our research. It's also been suggested that when you have these three basic needs of autonomy, competency, and relatedness met in the workplace, that is when you can actually influence intrinsic motivation. So otherwise, if we aren't able to influence intrinsic motivation, we're really reliant on the employee themselves to find that motivation within themselves and kind of procure it on their own. But if you can meet the basic needs of competency and relatedness, it's been demonstrated that you can actually affect somebody's level of intrinsic motivation, and make that person more likely to achieve their goals and their outcomes. So it's been shown that workplace performance peaks when workers are able to experience these three constructs, and then they're able to use the outcome of those three constructs to influence their motivation in a positive manner. And that they're able to use that intrinsic motivation in turn to influence their long-term behaviors and outcomes. Motivation, again, is a key component of workplace performance. So on top of, knowing what your job is and knowing how to do it correctly and safely, you also have to be motivated to do it correctly and safely. And while motivation does fluctuate throughout the course of one's tenure, one's lifetime, even one's day, or even just in the hour, motivation has been demonstrated to be a key driver of how workers perform in the long term. So anything that you can do to positively influence motivation will benefit the workers positively. Specifically, increasing autonomous motivation, so remember that's identified and intrinsic motivation, has been associated with increased compliance and better health and safety outcomes among workers. So, anytime a worker can behave safely because they understand and value the importance of behaving safely, or they find enjoyment and happiness in safety, is when they're going to have the better outcome rather than relying on external feedback and external components of their environment to inform their safe behaviors. So, it's also been suggested that the factors of self-determination theory and motivation are mediators between workplace contexts, and individual differences, and then the outcomes that workers have. So, workplace context describes things like the job design, the safety climate or culture, the workload of each individual, resources available, leadership styles, and the physical environment that workers are in. And then individual differences could be things like prior experience in that workplace or training, personal values, personality traits like conscientiousness, and feelings of efficacy on whether or not the worker can control outcomes. And then those outcomes that we're looking for that these mediators kind of function between are your workplace behavior, your workplace performance, and your employee well-being. And so, ideally, if you can provide a high level of autonomy, competency, and relatedness, you should be able to affect the outcomes that your workers are experiencing. My work specifically focuses on motivation and looking at how the mediator of motivation can influence workplace health and safety outcomes. But overall, the idea of occupational health and safety motivation and the constructs of self-determination theory are broadly applicable across industries, across contexts, regardless of what the task is and what the workplace context is. And what the outcome is that you're looking for, these constructs can be present across industries and across different workplaces to positively influence safety and make it a more proactive environment. I'm going to touch briefly on kind of where my work has lied and what I'm looking at specifically. So like I mentioned at the beginning of this presentation, I focus heavily on the aviation industry. And this is because approximately three-quarters of all accidents in aviation are attributed to human factors and errors. And depending on, what source you look at, what time frame, what location you look at, this number fluctuates between 66% and 80%. But regardless of which statistic you pull, it's clear that a majority of accidents in aviation are attributed to human factors and errors. And when we talk about accidents, this is not just those large scale like crashes or collisions that you hear about in the news regularly. This could be something that happens on a runway, right? So the vehicles that move baggage around could collide with one another. You could have an incident in a maintenance shop where somebody becomes ill because of a contaminant that they're working with, or somebody cuts themselves on a blade or something like that. Um, Continuing on in the aviation sector, the annual non-fatal injury rate is 6.3 per 100 full-time employees. So this says from, January 1 to December 31, for every 100 people in the aviation sector, 6.3 of them will have a non-fatal injury. The national average across all industries, according to the Bureau of Labor Statistics, is 2.7 per 100 full-time employees. Therefore, the rate among aviation workers is more than double that of the national average. Additionally, the armed services have observed a recent increase in Class C mishaps. So, Class C mishaps are incidents that cause between $50,000 and $500,000 in damage and/or non-fatal injuries that require time away from work. And Class C mishaps typically happen on the ground, so on runways or in maintenance shops. And it's important to note that Class C mishaps have been suggested as leading indicators of Class A mishaps. So Class A mishaps are going to be those that cause more than $2 million in damage and/or death or permanent disability. So Class A are your most severe. Those typically happen in the air. So a very well-known example of a Class A mishap was back in January of 2025 when the American Airlines flight collided with the U.S. Army helicopter and caused 67 fatalities. So all these together, clearly a large proportion of accidents and incidents being attributed at the root cause to human factors, an injury rate that impacts employees that's more than double of the national average, and an uptick in those Class C mishaps that indicates that we likely will see a higher amount of Class A mishaps in the near future, necessitates an urgent need to focus on human factors and errors in the aviation industry, whether you're in a commercial space or a military space. Additionally, when you look at aviation specifically, technology advances haven't displayed the same injury reduction and return on investment as you did earlier on in the aviation space. So when things like air traffic control and jet engines, standardized training, and crew resource management were implemented, you saw a drastic reduction in incidents and accidents and fatalities. The more recent advances like safety management systems, advanced weather radar, and fatigue management systems, while they have had incremental reductions in accident and incident happenings, they have not just demonstrated the same reduction that earlier advances have. So while we should certainly still continue to implement these controls and these changes, it's clear that we need to focus on the human factors and errors and look at motivation specifically as a key driver of behavior and performance in aviation. This is some of my initial findings. This isn't published yet, so please don't cite or reproduce this at this time. But when I surveyed a cohort of aviation workers, these are the types of motivation that they described. So we had about 28%, so just over a quarter of participants indicate that they function under intrinsic and introjected motivation. About 14% I indicated that they function under identified and introjected, 43% under identified, and 15% under introjected. And then, as a reminder, introjected is that kind of motivation that says you would feel really guilty or shameful if you didn't follow occupational health and safety policies and procedures. My work and the individuals that this data is coming from are with critical care air transport team training at the Wright-Patterson Air Force Base in Dayton, Ohio. So these participants are nurses and physicians and respiratory therapists that have already been trained and certified in their respective disciplines. So they are already trained and certified as physicians, as nurses, as respiratory therapists. And in the cohort that I'm working with, they are undergoing training to be deployed into critical care settings. So they are working to learn how to load aircraft with the equipment and tools needed to care for critically ill or critically injured patients out in the field, while simultaneously caring for these patients and then transport them back to the nearest hospital. And I mentioned earlier that typically people fall pretty cleanly into one of the five categories, which makes it really interesting that we are seeing kind of this overlap between intrinsic and introjected. The presence of the intrinsic and the introjected and kind of the overlapping groups indicates that individuals are motivated by their interest and enjoyment in safety or the recognition of the value of safety and or the value of rules and regulations, but also have some level of guilt or shame associated with unsafe behaviors. And I anticipate that this introjected piece comes from the fact that I'm surveying a military population and that there's an ethos in the US military that really talks about loyalty and teamwork and supporting one's mission, and kind of this idea that we never let our team down, especially in this context where the participants in this study are working on a very close-knit team. They're training as a team of doctors and nurses and respiratory therapists to stabilize a patient and get them to the hospital. So especially since they're working so closely with one another, I anticipate that some level of this introjected feeling is coming from the idea of if I don't do my job correctly, I'll let my team down, and my cohort won't be able to pass the class or complete the training sim successfully. So I would be really interested in expanding my work into civilian populations and look at commercial aviation workers, and kind of see how that difference might play out. It's also important to note that these individuals have self-selected to participate in this training, and then have from the training self-selected to participate in my study. So that could be why we're seeing a higher level of intrinsic and identified motivation. You have people who are eager to kind of further their training within that military context, and then from there, eager to participate in a study that's all about safety. So just by nature of the study and the recruitment process, we could be excluding those who are functioning under external motivation, which is again why I would be more interested to further my work in the commercial setting, and look at those workers who might be externally motivated and see what contexts of their environment can be modified to encourage safe behaviors. So, implications for research. There is a pressing need to focus on occupational health and safety motivation when considering human factors and errors and performance. Like I mentioned, it is kind of an emerging pillar of occupational health and safety, and our current injury rates and our current proportion of incidents that are attributed to human factors and errors show us that we critically need to focus on this aspect of performance. Workplaces as well tend to rely on external motivators, right? Because these are the really easy things to do, right? It's very simple for workplaces to say you'll receive a write-up or a suspension or some kind of corrective action if you don't follow this procedure. It's really easy for workplaces to say if we can make it X number of days without an injury or a lost time or a day away from work, we can have a bonus or we can have some kind of group gathering or group party. External motivators are the easiest things to cultivate and the easiest things to give out, but it's clear that intrinsic motivation is what drives long-term performance and behavior, which means there is a distinct need to cultivate autonomy, competency, and relatedness to cultivate that intrinsic motivation in employees and understand kind of what, from an organizational perspective, can be done to cultivate those constructs in workers, and not only kind of grow them initially, but also what allows them to function in the long term. And then further work is needed to better understand what workplace practices improve and sustain intrinsic motivation specifically across environmental and cultural contexts, right? So it won't be the same for each worker. It won't be the same for each individual in each industry, and it could even differ for one person, year to year, day to day, month to month. So that's kind of where my work is sitting to try to understand how are workers motivated, what is motivating them, and then what aspects of their environment can we modify to help increase that level of intrinsic motivation. And I look specifically at the training context and if workers are understanding that level. Again, in order to behave safely, workers have to have not only safety knowledge and safety awareness, which is gained through their occupational health and safety training and coaching moments that happen throughout the workday. So I have to know, I can't keep something right in front of an electrical panel, but then I also have to have the awareness to go out into the field and notice that that is a hazard and then take corrective action. So again, my work is sitting really cleanly at the intersection between motivation and training. And I'm understanding how workers with different levels of occupational health and safety motivation are engaging with that training to see if they're gaining the necessary knowledge and awareness through their health and safety training. And then understanding how their motivation is influencing their performance in training and then their long-term outcomes as well. I know I've mentioned training a lot and understanding how workers are looking at training and perceiving training. I use eye tracking technologies to do that, and I would love to chat with anybody after this presentation who might be doing similar work or who might have interests in what eye tracking is and how it can be used. And then there is a need as well to investigate how training and motivation intersect and how the components of each part might influence the other. In terms of implications for practice, while we don't have a very clear understanding right now of how occupational health and safety motivation can be cultivated and how it can be influential through training in long-term contexts, we do know that autonomy, competency, and relatedness are factors that can be kind of pulled right away. So if you are in that industry context, think about how these three constructs can be supported. For the individual worker, it means that autonomy means that they have the right to make decisions about how their work goes and raise concerns about their work. Competency should be something that is developed and not viewed as a fixed trait, so that safe behaviors are naturally kind of built into the process of the worker and not something that require extra effort or workers to go out of their way in order to behave safely or get the resources and tools that they need to engage in safety behaviors. Relatedness as well should be cultivated among workplace teams, and conversations with colleagues can be viewed as a resource to hazard recognition. And then from a supervisory perspective, think about how can you support autonomy. So can you involve workers in decisions regarding how to meet standards and meet goals? And can you involve them in conversations regarding how do we want these outcomes to happen? How can we, push ourselves towards the outcome that we are looking for? For the supervisor as well, how can you support competency? So rather than training at kind of seemingly arbitrary intervals, a lot of times we see things like lockout tagout is just done on an annual basis. Things like first aid and CPR are just done annually, regardless of competency. It's just an annual box that you have to, undergo our chemical training every year, sign that we did it, and then we leave. Is there a better way to do that? Do we have a different interval that we should be complying with? and how can we support ongoing and low stakes training opportunities with our employees. And then in terms of relatedness, how can we support our employees throughout the workday? How can we acknowledge a job well done and take notice of the efforts that are being done in order to engage safely? So overall, that is kind of my high-level overview of occupational health and safety motivation in the workplace. I want to acknowledge my advisor, Dr. Nazarenko. He has been instrumental in me kind of deciding occupational health and safety as my dissertation topic, and kind of helping me get started with the data collection phase. Like I mentioned, I am in the data collection phase at this time, so I hope to, at a future presentation, have more concrete results to share, especially and kind of talk about what I found and what that means for future work in the occupational health and safety motivation space. My email, as well as Dr. Nazarenko's email, is located there. But at this time, I think we have time for questions, and I'd be happy to take any.
Thank you, Hannah, for a very interesting presentation. We've got a few questions coming in. Feel free to use that Q&A box at the bottom of your Zoom screen to add any. So we'll just get started with questions. We had somebody ask in the chat a question that I think is related to workplace culture and motivation. This person was asking, machismo is often cited by workers unwilling to wear safety glasses or other personal protective equipment properly. I think they're saying, it's like it looks silly or maybe nobody else does it. And it seems like it's this breakdown of relatedness, especially.
Mhm.
Have you encountered that? I mean, it seems related to culture and workplace culture. Are there ways in which like certain attitudes around safety and this kind of like risky behavior can be mitigated?
Yeah, I think that's a great question, and that kind of hits at a point that is kind of an ongoing issue in terms of compliance and PPE, especially with highly tenured workers. So you'll see a lot of workers that say like, "Oh, I've worked this way without the PPE for years, and I've never had a problem." You see it a lot with hearing loss, especially with people who work on runways in aviation. So you'll see like really one-sided hearing loss because they take out one earplug to listen to conversation, and then they have hearing loss in that ear. Unfortunately, I don't have the clear-cut answer to that, and I think that is kind of an ongoing research question that I'm interested in probing. Is looking at what factors can we make the PPE better looking or more interesting to wear? Can we make it an integral part of the process so they can't even begin the work until the PPE is on? I think overall, increasing that level of surveillance, so kind of that external component, isn't always effective or isn't always necessarily welcome by workers. So if we can make it something that is interesting to them or helps them feel like they can do their job more in a more with better efficacy, or even relate to their coworkers better, is really interesting as something we can look at. I'm doing eye tracking research right now along with my motivation, and it's been really interesting. The things that the workers wear, these like large glasses that they put on, they're not super big, but they are noticeable, and it's really interesting to see the cultural responses I get to those because the point of wearing them is to kind of better understand the environment and better understand how the worker is perceiving the environment. And yeah, you sometimes can see in the recordings, they'll have colleagues be like, "Oh, like you look super cool," or like, "Oh, you're super fashionable." And you'll have other people who respond a little bit more negatively and say like, "Oh, like, what are you wearing? What's that?" So again, I think that's, kind of the crux of occupational health and safety compliance that we're all facing at this point. And definitely is something I think that warrants further research and investigation.
Yeah, it's super interesting thinking past just, a supervisor telling you that it's important to do a certain thing for health and safety, but like thinking on a more holistic perspective, like what does it look like and what's actually going to get people motivated to use it.
Absolutely.
Um, I had a question, I'm curious if you've encountered this in your research at all, but the role of automation now when it comes to health and safety motivation, like I could see two situations in which there's increased automation through artificial intelligence, and that can make people really motivated to, or, it gets them excited because it's like a helpful tool for them. And then in other situations, there's this mistrust and there's kind of this attitude of like, well, I don't want to use that, and that's going to affect how I do my job now. Have you considered the role of automation at all in your research?
Yeah, so I've definitely considered it, and Dr. Nazarenko, as well as my other lab mate, Oninia Zafika, who presented recently as well, have worked on papers about predictive AI in aviation. But I think it is something that could be investigated. The participants that I work with do work in mixed reality settings, so they can kind of train with like an overlay of an artificial environment in their training. And the people who I have been working with have so far been really accepting of it. It kind of helps them to anticipate and recognize hazards more cleanly in the workplace and more easily. And to my understanding, it helps them feel more prepared. So the people that I am surveying and working with as participants are training to be deployed into like ICU settings. And so having that extra layer of artificial intelligence that they can kind of interact with and influence their training is something that they generally welcome and see as something that can kind of boost their knowledge. That way, when they see this happen in the real environment, they already have experience responding to that hazard. So from like a training standpoint and from an anticipatory standpoint, I think it could be really helpful, especially because it gives workers that opportunity to practice with a hazard or a situation before it's encountered. In terms of having it integrated on the other side, I don't have as much experience with that. And I think it would definitely be something to consider in terms of the acceptance level and how is that impacting feelings of competency, especially and self-efficacy. If the AI is taking over part of the job or it's having an increased level of monitoring on the worker, how does that influence cultural components and feelings of, I can do my job and I have an actual way to impact the outcome of my work.
Yeah, it seems like in the best possible situation, it would increase that competency
Mhm.
and make people feel better about, their health and safety at work.
Absolutely.
I had another question. This is from an anonymous attendee. In terms of communication failures, even good insights can fail if they are not communicated effectively to stakeholders, like if they appear too technical or they're not aware of the context as much. How do you address these gaps? How do you kind of create like an iterative process when it comes to communication and motivation?
Yeah, I think, like I mentioned, feedback is really critical in motivation. And of course, like we all want to be told, like you're doing a good job, and we want to be recognized when we do a good job. I think in terms of like a framework for communication, it really comes down to the individual context and what works for that workplace or that group. And even kind of the feedback loop is individual to each person. So some people want to be told, very regularly that they're doing a great job, while other people would prefer it at a, longer increment or, not every hour. They want it once a day or once a week or whatever. And so I think, how you integrate that into a workplace or an environment would be really contextually dependent, not only on the environment that you're working in, but also on the preferences of the individuals within their environment and what they need to motivate them, right? So if you have somebody who's intrinsically motivated, they likely don't need that same level of feedback as much as somebody who is really reliant on that feedback. So a place to start could be just using that scale to determine like what level of motivation people are functioning under, and then kind of go from there, considering the individual contexts and the individual workers that you're working alongside.
Thank you. We have another question that I think is related to this idea of feedback and individual feedback. Do you consider mental health at all in like how you're considering motivation? Say if somebody is a motivated, and then you kind of look into like just their overall experience of the job. How would you how would you talk about that in relation to motivation?
Yeah, I haven't looked at mental health as a proxy of motivation or understanding the intersection between the two, so I wouldn't be, great on speaking at those, but I definitely think it is something that warrants a conversation or could look into future work. And understanding if somebody is motivated, is it kind of just a characteristic of them, or is it something else that we can affect and kind of create that positive outcome? So I definitely am not very well versed in that topic and would definitely be something to look into.
And I think it like points to ways in which like structural conditions would affect motivation in the workplace and like what can the employer do to improve conditions. Um, I wanted to do another question. This is also from an anonymous attendee. Often in workplaces that use external motivation, like a pizza party or a bonus for the collective, when benchmarks are hit, you will hear of instances of pressure to not report injuries so that it doesn't affect the group. How would you recommend addressing that? Since in my experience, it feels that so many workplaces are not interested in building intrinsic motivation.
Yeah, and that is kind of another issue that we see with external motivators is people saying like, "Oh, don't report it. We don't want to lose our bonus," or something like that. And that comes down to that social component of external motivators. In terms of cultivating it, it really does come down to a culture shift and wanting to kind of push that difference along. I think motivation is kind of a hard thing to push because it is so intangible. It's kind of just like a concept that floats in space. I think if you're trying to get through to a group of people who maybe aren't well versed in motivation or don't see the importance of it, just start by relating it to something that they know. I opened today with like, when's the last time you took a risk and why'd you do it? Just think about something like that. I think, if you have run a red light in the past or you've run a yellow light and you've had a car accident, you're very unlikely to do it again. And so if you think about those things and kind of probe at, why do we take risks? Why do we do that? And how does that risk taking kind of tie into our motivation? That potentially could, get people to understand the importance of motivation in the workplace, and then kind of push people towards that idea of intrinsic motivation. It also can help just to, there's a lot of literature that's been done in the psychology space on the importance of self-determination theory in the workplace. Not only does it influence safety outcomes, but it also influences productivity outcomes, retention and turnover. If workers feel like they, have a say in their work, they feel like they have a lot of self-efficacy and they feel, happy in their workspace, they're more likely to stay around and not leave the job. They're more likely to have, high productivity and strong outputs. So really, impacting that intrinsic motivation doesn't just make a safer workplace, it also makes one that, is more productive and is more enjoyable and has lower turnover. So I think, with safety in general, if you can frame it as something that's more than just safety and how do we all benefit from this as a collective, that could be a place to start for sure.
Thank you for that. Let me see other questions that we have. Um, this question, it's related to what we were talking about earlier in terms of like the structural conditions of work. For example, so this person asking, I wonder if you've looked at how structural conditions might work against motivation. For example, when workers are under time pressure or work overload, does that overcome any motivation they may have to be safer? In that case, it would be on the employer to change those conditions. We've talked about that a little bit, but I wonder if you had anything to add.
Yeah, that's a really interesting point, and that kind of ties into a study that I am also working on as well that talks about cognitive control, which is essentially the worker's ability to inhibit like impulsive responses and act towards in a goal-oriented manner. And so that study looks at how do I consider motivation? How am I able to inhibit my impulse responses to move towards a goal? And that, as well as my current research, looks at how workers are perceiving the environment and the cognitive load that they're getting. So, if they're really bogged down by the information that they're looking at, are they able to decipher what they need to move towards that goal and do the safe behavior that is conducive to the outcome that they're looking for, or are they just distracted by the environment, or are they unable to inhibit an impulse? And therefore they behave in a way that's potentially contradictory to their self-described motivation. So kind of looking at those environmental factors as well as internally, like how well a worker is able to put aside, impulses or pressures from the environment to work towards a goal is what I'm working on right now and what I hope to kind of demonstrate in my dissertation.
Yeah, it's super interesting. I think like yeah, thinking about when a worker may have this messaging around like how to be safe, but then there's a certain dissonance because of like the pressure of the work environment that's coming from the employer.
Yeah.
Um, I'm curious if you looked at any situations in which there's the unfortunate case that there has been a big accident, or, you mentioned the helicopter crash that happened in DC.
Mhm.
Um, I imagine that after something like that, there is a huge focus on health and safety and kind of making sure that it doesn't happen again. Have you looked at how that affects motivation in, say, like a really public accident or, this aspect of like, of course, we're always trying to do preventative health and safety, but then like something happens, and how does that shift how workers think about the job?
Yeah, I have not, and I think that could be another interesting avenue to go down and look at, especially if they're, in a similar role or they closely know people that are involved. How does that influence outcomes, and how does that influence their motivation? Sometimes people's, why I behave safely isn't even due to something that they've experienced. It's due to something a family member or a friend or a, beloved colleague has experienced. So, I haven't personally looked into that, but I think that is certainly an interesting avenue to look at.
Great. Thank you, Hannah. We're right at the top of the hour, so I just wanted to thank you again for presenting today. Thanks, everybody, for your wonderful questions. And we hope to see you at our next webinar next week on Wednesday. Thank you, Hannah. Thanks, everybody. Have a great day.
Yes, thank you.